AskReddit by BabaHippo01. Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? There is a reason the instructions for prescription suppositories say unwrap and insert and not just insert. Do not take orally. Physical therapist had a patient with neck pain and spasms, also complained of anxiety and heart palpitations. Asked about caffeine intake and patient revealed drinking an average on 15-20 cups of coffee daily. One of my dumber moments in my younger years. I'd stay up all evening drinking a pot of coffee and chatting with friends. Later around 4:30 AM. Why am I still awake? Had a buddy who was an EMT. He was called out to location for a gunshot wound. Apparently what happened is a father was mowing his lawn when he accidentally touched part of the mower near the engine and burned his hand. He got mad at the lawnmower, pulled out his pistol, and shot it. The bullet ricocheted and hit his son in the leg. My brother shot himself with a ricochet hunting one morning before school. Dad had a doctor write that he was missing school and later paid due to gunshot wound to the leg, in his note. That note is now framed and hanging in the living room. He's oddly proud of it. No clue why. Gun safety is a huge deal to him. We weren't even allowed to aim Nerf guns at people or pets. Not me, but my mother would pick up shifts as a nurse sometimes in labor and delivery, and she had met a handful of women who didn't know the baby was going to be coming out of their vaginas. Like no clue. My mom usually said something like, "How you got it in is how it's coming out, honey." This was the late 90s, early 2000s. I'm a social worker and one of my clients literally kept getting pregnant over and over after having kids. And I had a frank conversation with her about birth control or getting her tubes tied because she kept going through horrific births only to get her kids taken away, and she actually said to me that she didn't know that birth control or safe sex would save her from getting pregnant. She didn't realize that sex equals pregnant because she was sexually abused as a child and her father told her that she could only get pregnant when she's in love, and she had never been in love, so she didn't understand why she kept getting pregnant. Sex was only pleasure for her, so she didn't realize that was what was having her get pregnant. Edit, typo. Rurally our doc here. 35-year-old female walks in with right-sided jaw neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to. 10 minutes later, oh yeah, and I accidentally swallowed a bee and it stung me in my mouth right before this happened. Sorry, I forgot to mention that. A friend of my mother's died from a wasp that got into his drink. He swallowed it, it stung him on its way down, and despite having no allergy to stings, the swelling was enough to close off his airway. Not me, but my wife, who is a vet, had a client who got mad at her because he didn't realize that once he neutered his dog that he wouldn't be able to breed it. As someone who worked at a vet office, I am completely unsurprised. We once had to explain what smegma was to very embarrassed owners of a new puppy who brought him in for discharge around his penis, not to mention the countless people who bring their cats in asking about a lump only to be told it's a nipple, and then you occasionally get the inevitable "but he's a boy" and have to explain that male mammals have nipples too. Like, mom, you are married. Have you never noticed your husband has nipples before? I miss working there. Had an 18 or 19-year-old girl come in my ER with some complaint that required an x-ray. It's standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never had sex and there was zero possibility of pregnancy. We did the test anyway and it resulted that she was pregnant. We did a blood pregnancy test to confirm the result, since she insisted she couldn't possibly be pregnant because she'd never had sex. That was positive too. We gave her a few minutes to herself to figure out what the hell happened, and when I returned to check on her a short time later, she asked me if she could get pregnant even though her boyfriend didn't go all the way in. She 100% believed that long as his penis wasn't entirely in her, it didn't count as sex. It took nearly a half hour of explaining reproduction to her for her to understand that whether it's What do you call guys that use the pull-out method of birth control? Fathers. Had an adult male patient who needed a Foley catheter. His mother was in the room, and they both lived together in the backwoods of TN. I informed them both of the order for a catheter, how it works, and why it was needed. His mother stated, well, he's still a virgin and I'm not sure I'm comfortable with his virginity being taken in a hospital. I hope that was just a joke. Hell, I'd tell that joke. M's here. Had a diabetic in his 30-40s who refused to take insulin since 2012. It was 2020 at the time. When I took his blood sugar is only read as high, meaning it was over 700 for glucometer to not read it. Upon seeing this, he asked me if that was high and then went, is this cause of all the ice cream I ate? Played Facebook Messenger video with his girlfriend the entire time. Met him later on the parking lot after he got discharged, and it took this man less than 50 paces from the ER door to rip off his bandage covering his IV and play with the IV wound until it started bleeding all over the place again. Knocked on our ambulance door and asked for a band-aid to fix it. We had to walk him back into the ER and bandaged his entire arm with gauze so that, hopefully, by the time he got it off it would have clotted enough for him to not end up exsanguinating himself. I had a guy once stop me to ask me a question. Young, early 20s, tells me he's a diabetic but he doesn't ever check his sugar or anything. And I have a weird tingling in my feet. Is that a big deal? Yes. Yes it is. Once had a guy come into the emergency room because he snorted a random white powder found in a plastic bag left on a random bench in the middle of a sketchy park and started feeling suicidal. Are you sure he wasn't suicidal before snorting the mystery powder? My sister told me a story of a woman with chronic blisters and lesions on her lips. They couldn't figure out what it was for weeks. It would heal and come back. Heal and come back. Turns out she would jam out on like 3 bags of salt and vinegar chip a day for weeks at a time until the sores hurt too bad to continue, then she'd go to the doctor. I eat S&amp V chips till my tongue is numb and I thought I was weird for that until now. This happened in med school on my OB in rotation. Patient, who's the baby gonna look like? Me. What do you mean? Patient, well, is it gonna look like the dude who got me pregnant or the guy who's been nutting in me the last few months? Me. Utterly speechless. The baby should look like the people who conceived it. This person is now a parent. Edit. Fixed a typo. Nutting in me the last few months. Hahaha. Had a patient come in for facial burns because he smoked while wearing his oxygen, twice, in the same week. Just had a man die to this in March. https://www.mobi.tv/023/208/deadly-main-fire-cause-b-y-man-fire-cause-rule-accidental/ He had burned down his home the day prior and then proceeded to burn down his friend's home and die. Thankfully the friend survived. This was one of the funniest yet cutest one. Was a student doing a shift in andrology reproductive health. Doc, so you're trying to have kids but not managing to. So do you have any other kid? Patient, yes doc, I have one. Asterisk. Doc, so we need to do this and this and that. Asterisk. Patient, great. Then he proceeds to visit him and stuff, after which he goes away. After a couple sex he knocked the door again saying, "Hello doc, my wife told me that it would be relevant to you that the son I have is adopted, but that's make no difference to me, I always considered my own son." That, whilst a trifled is lovely to read and a nice palate cleanser from the idiocracy nonsense and the pressing self-sabotage in the thread above. My wife is an anesthesiologist. When training junior doctors, one of the things she has go reinforce over and over again is that you never leave drugs unattended in an unsecured area in a hospital, even for a moment, because some people see drugs and think fun and take them even if they don't know what they are and they just raided a trolley or picked up a syringe off a bedside table. And then, because the drugs used for anesthetics in hospitals are quite serious, those people quite likely end up dead or vegetables. And this has actually happened more than once in hospitals she has worked in. When doing a medical resupply in Iraq, one of my dudes lost a cooler of rock uranium. A whole flat of vials just somewhere in Iraq. Rock uranium isn't a fun drug. It's a paralytic. You just stop breathing, completely awake and aware of what's going on around you. Anybody remember the Vanderbilt med era? Similar drug. Vecuronium instead of ROC, both non-depolarizing neuromuscular blockers. We all just waited for news of some soldiers or Iraqis dying mysteriously after sampling the ROC but never heard anything. I was using meth for weight loss, have heard a few times actually. Pharmacist. Don't even know where I would begin for some of the ridiculous situations I have had. Up there however has to be whenever I had a lady swallow a full box of suppositories and came in to complain that the issue has not cleared up and the medication tasted bad and was hard to swallow. Do sometimes wonder how people put one foot in front of the other. There is a YouTube channel called Chubby Emu. He's a toxicologist. In one episode he covers a person who thought that the Costco size pack of Costco brand Tylenol was a course of medication that you were supposed to take in a month. I believe it was like a 2-pack of 1000 pills per bottle. I don't know if cleaner in a hospital counts, but this one time I got to work early on a Saturday morning and we immediately received a request for help from the ER and got sent over by my boss. When I got there, the first thing I heard was yelling from this guy behind one of the curtains. He was shouting at the nurses, "Don't touch my penis," and I didn't use any drugs. Then I smelled iron in the air and then I found out there was blood all over the hallway, handprints in blood against the wall. Almost the entire floor was covered in blood with actual puddles in some places. What happened? The guy pulled out his catheter causing arterial bleeding and decided to run away from the nurses who were trying to help him. It seems like he lived through that. I never seen that much blood before that day nor after. Reading this brought pain. I'm squirming in my chair at work thinking about ripping out a catheter like that. Former vet tech. Had a woman scream at me and my vet for telling her it's the law to have your dog vaccinated against rabies. She said the rabies vaccine causes autism in dogs and makes puppies stupid. Side note. 3 weeks later her puppy died of parvo. She got another one immediately after and did not clean her home. 2 more died in the following months. Animal control and the city had to get involved. That's freaking sad and anger provoking. I hope she was banned from ever having an animal in her possession again. My dog is a parvo survivor. My Sil is a veterinarian, and she saved him. He just turned 17 and still doing great. Vet med here. We get a lot of patients who need to go on medications for a wide array of persistent problems, and these medications keep them under control. So we often get ones with thyroid, diabetes, heart issues, etc. and start them on medications. The patient starts to do great, comes in for another recheck, and is awful. We ask the owner if they are still giving the med. Nope, they stopped it cause they were all better. We fully educate the owner, go over medications, and give notes on what to do, and they still do this. My dad is like this. Won't feel well, goes to doctor, gets prescribed a round of antibiotics, even if it shouldn't be treated with antibiotics, takes them for a week until he feels better, stops, then wonders why he's not getting better anymore. And this man is an engineer. Not a medical professional, but I used to volunteer at a free medical clinic to take vitals and histories. A woman came in with pneumonia and wanted to know why her normal treatment of drinking half a bottle of Listerine and smoking a pack of cigarettes a day wasn't working. I asked why she thought smoking was good treatment for a lung infection and she said, Indians used to purify the ground by burning all the weeds away before planting. So I'm smoking to purify my lungs. I left that one to the doctor. Pharmacist here. I had a woman bring in a literal sandwich bag, unseparated, which she kept all her meds in. She needed help seeing which meds she was low or out on and asking different questions on the medications. When she pointed to an apical stating it was her blood pressure medicine, I immediately became concerned as to why pet medicine was in her bag. Also why she is mixing all her meds in a bag in the first place, only to find out that she had been throwing her pet's med inside her bag of medicine. So Lord knows what she's been giving her dog or taking herself. I immediately stressed how important it is to keep medicine in its original container to protect the medicine and herself and to know the directions of how to take it. I've seen her a few times since then and glad to see she has since taken my advice. But how any pharmacist or doctor hasn't advised her on this before is beyond me. Literally yesterday. Consumed 8 cans of Red Bull in a 2-hour time frame. Presented with palpitations and severe chest pain. So, you're lactose intolerant? Yes. And you knew this before? Yes. And you drank a milkshake? Yes. What size? Large. The rest of the night was the kid screaming and groaning in the ED waiting room. YOLO. Lactose intolerant milkshake enjoyer. I work in veterinary medicine and clients are absolute idiots who are convinced that they are the smartest people in the world. It is amazing that pets actually manage to stay alive. People will believe just about anyone else over the advice of their veterinarian, their breeder, their relatives, their lawnmower, the person bagging their groceries. I had a client blind their cat with tea tree oil because they read about it on the internet. Clients change their pet's medication dose for whatever reason. That's really fun when it is insulin. Not follow post-op instructions causing their pet to eviscerate itself or blow the knee we just repaired. Feed their dog pot roast with garlic and onions as their bland diet.